My name is Bilan, and I'll be facilitating today's meeting. I'm currently in the Play Equity Coalition leadership team, and I'm also the Associate Director for African Community Housing and Development. And we are so grateful for you to all join us today. And before we get started, I would like to acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present, and honor with gratitude the land itself and the Duwamish tribe. And I just want to let you know that today's agenda is to ask cross-sector experts about free play and give us a chance to ask questions, and hopefully they can respond to them. The panelists that we have invited today are, you can move to the next slide. Jesus, who is with Seattle Parks and Recreation, Philipia Goldsmith, who is with Seattle Housing Authority, Caitlin Pontrella, Board President of Parkour Visions, and Dr. Pooja Tandon with Seattle Children's Hospital. Quick norms for today. We only have about 40 minutes or so we'd love for everybody to stay muted unless you're asking a question, and we will get started with questions. So my first question is, what are the educational, mental, and physical benefits of free play, and why is that even more important now during COVID? And I will also like each panelist to just share a little bit about themselves and respond to this question, and you have about 2 minutes. I'll start with Pooja.
Yeah, hi everybody, and thank you for having me here for this very timely and important conversation. So I'm a pediatrician at Seattle Children's and University of Washington, and I spend a large part of my time also working on public health research that focuses on promoting healthy behavior and decreasing disparities in access to opportunities for kids to engage in healthy behavior, specifically physical activity and outdoor time. And I think that kind of really segues into this first question very easily. There is so much research, so much evidence out there on the range of benefits that free play, particularly active play, physically active play, offers for children. So we know that when children, and this is especially true for the youngest children, but even as they get older, when they're outdoors, when they're allowed to choose what they want to do, again, especially the little ones, they usually choose to move their bodies. And physical activity has benefits for their heart health, their sort of muscles, and maintaining healthy weight status, improving their immune system. So those are kind of physical health benefits. But even beyond that, there is good evidence now that physical activity and engaging in play and self-directed physical activity is good for mental health benefits. So for that, the research tends to be in slightly older children and adolescents in terms of symptoms of depression and anxiety and responding to traumatic events that may have occurred. And then finally, educational benefits. There's, again, evidence that children perform better in terms of their ability to focus, pay attention to academic work, their behavior in classrooms, and even things like test scores and standardized test scores and grades. There's some evidence to suggest improves after both short periods of physical activity and being active over time. So yeah, a whole range of benefits. And then, I mean, as you can see from the list of benefits I mentioned, all of those are so critical and magnified during COVID because, we want kids to be at a healthy weight status. Being overweight or obese is linked to worse outcomes with COVID infection. We want their immune systems to be strong. We all need kind of the mental health benefits afforded by being able to play and move. And learning is so challenged right now in terms of remote schooling and hybrid and everything going on. So So yes, all of the benefits are so critical and so important right now during a time where there is risk of infection, and even for people who don't personally face infection for themselves or their families, sort of being able to respond to all of the stressors that COVID has put in front of us.
Thank you so much, Dr. Pooja. And I'm going to hand it off to Caitlin. Oh, Caitlin, you're on mute.
I'm used to not being on mute. Sorry. Thank you. Thank you for having me. And so I'm a community builder and researcher. And I currently am here today representing Parkour Visions, where I serve as their board president. We're an organization that brings urban recreation programs to youth and adults with a focus on reaching communities furthest from opportunity. I also have a background in architecture, public art, and parks, and have been a long time advocate for play for all ages and the design of spaces for play. And speaking to the question itself, before COVID, I think the average American, it was being reported that by the time they reached age 19, they were as sedentary as a 60-year-old. And national data was revealing that 30% of adults weren't engaging in any leisure physical activity at all, with more than half meeting minimum requirements. And play is considered so important for human development that the United Nations has recognized it as a part of one of its human rights, that it's a right of every child. And it's something that stays important as you grow up. And I know a lot of the organizations here have a big focus on youth in play. But again, I really want to call attention to the importance of teens and adults as well. Play not only releases, endorphins and reduces stress and improves brain function, as Dr. Pooja was speaking to a little earlier, but it also can facilitate, connections between strangers and build intimacy. And it can be used as like a tool for self-improvement. And obviously in this context, we're talking about play as a form of physical activity, but play can also be, art, movies, music, writing, with the focus really being on the experience you're having and not just the endpoint. And specifically to COVID today, it's not just physically isolating us, it's also emotionally isolating us. And we need not just the physical skills to be active, but also the community spaces to be active in. So that's what I have to say.
Thank you so much, Caitlin. And I'm going to pass it off to Jesus.
Thank you, Bilan, and thank you to all the panelists. I mean, I think, and of course to the Play Equity Coalition, I don't have much to add. Well, sorry, let me back up. My name is Jesús Aguirre. I currently serve as Superintendent of Seattle Parks and Recreation. I also like to tell folks that I'm a recovering educator. Most of my career is actually in education. I think Pooja and Caitlin really have sort of shared all of the things that we all of us involved in this work think about in terms of why it's important for children especially, but for all of us to get outdoors and to be active and to be in nature. And certainly the pandemic has really shown us how most crises really impact communities of color, lower income communities even more so. And then add to that the economic impact of the pandemic continues to have even greater impact on those communities. And so, we at Seattle Parks and Recreation see our job as just providing access to folks, to everyone in the city. And we've seen how difficult it is for us to be able to let folks be outdoors and come together and socialize and do all the things that play does for children and that being outdoors and in nature does for communities. So I think that all of the physical and mental reasons for the importance, we all know these things. I just think it's really important for us to note that with these all of these crises happening now, it's just much more important for communities of color and for under-resourced communities. We'll share the link in the resources later, but the Children in Nature Network is an organization that has a pretty decent research space that shows all of the reasons why it's important for young people in particular to be outdoors, to be in nature, and also for free play. So lots and lots of research to get us all to continue to advocate on these issues.
Thank you so much, Jesus. And we will, let's go with Philipia.
Hi, my name is Phillippia Goldsmith, and I am a community builder with Seattle Housing Authority for a community in Southeast Seattle, the New Holly community, and I work with predominantly East African immigrant families. And so I just want to also say thank you to the panelists who are definite experts in the educational and mental benefits of play. But my role is I spend a lot of time listening to families and working with families and ensuring that their voices are heard. And upon my listening, and especially during COVID time, kids want to get outside. They have been inside for a very, very long time. The schools are closed, libraries are closed, community centers are closed. I got to tell you how beautiful it is to go outside and see a kid riding a bike right now. And as much as we're like, go in the house and stay in the house, they just want to be out and be creative. And this community that I work in, it's a mixed income community. So we have families from all spectrums. So I think it's beautiful and important to have spaces for kids to be out to connect with people from different life experiences and different journeys. So I will just tell you that we got to have places for kids to get out and for families to connect. Where I'm sitting at right now, I'm looking out the window at the Chief Self Trail. And sometimes I see groups just walking the trail for getting exercise because gyms are closed. So it's just really a beautiful, beautiful feeling to be able to see that happen. That's what I can add.
Thank you so much. Let's go with the second question. Adrian, can you move to the next slide? So COVID is so funny. I just realized my mouse stopped working. So I'm going to rely on Adrian a lot more than I needed to. So my next question is, what can you tell us about the inequities of who is and who isn't getting free, safe, unstructured play in King County? And I'll start off by asking Philippa.
Okay, great. So I can just tell you right there, families, individuals with limited resources, families who may not have a backyard or who live in apartments. We're building a lot of apartment buildings these days with limited spaces. So I think those are folks who are not getting access to safe places to be. And then, yeah, that's what I believe, families with limited resources. And also, I just want to add, also families may have limited time because we're stressed with different things going on in our lives. Work, we all know it's kind of like speaking to the choir, but limited time to be able to supervise kids, and so and it's getting darker. There's quite a bit. So there's quite a bit of inequities across.
Thank you so much, and I definitely recognize that back in our South King County, where I serve predominantly East African community. Let's go with Caitlin.
Yeah, absolutely. And I think she started harping on this, but there's so many barriers that are preventing people from engaging in play. Again, both children and adults, cost, time, geography, social, emotional, political elements all come into play and need to be taken into consideration. I think a recent study, lots of studies have shown, but also a recent one done by the King County Play Equity Coalition was showing that inactivity was directly linked to household income. We live in a world that it's all about pay to play, whether you need to get a gym membership or you have to pay a fee to be a part of a league. You have I think by 2017, over 30,000 schools cut recess. So it's not necessarily even inside school time. And as you mentioned, parents not having time, but even as adults not having time. Geography, park proximity, especially in lower income communities, traditionally do not have quality parks within a walking distance. And I think it should be like a quarter-mile walk, a 10-minute walk to a park. And I think there's even a national initiative with, maybe it's the City Parks Alliance, about the 10-minute walk, or the Trust for Public Land, sorry. But then, yeah, even the social emotional barriers, things like your past experiences and relationships with movement and play, they can be negative, especially if you have issues with weight, issues with discrimination being in public spaces. We don't have to really speak too in depth about the policing of our public spaces in different communities, as well as just the rejection of competition in traditional sports and general self-consciousness. So all these sort of factors stop people from playing.
Thank you so much. And Dr. Pooja, what are your thoughts around inequities and who isn't getting free, safe, unstructured play in King County?
Yeah, adding on to what Philippa and Caitlin said, I mean, really this year has just magnified all the inequities that already existed, right? So we know from like the state of play report from last year and from really national data that it's that same list of individuals and communities that face these inequities. So children from low-income households, children of color, non-English speaking households, children with disabilities, homeless children. So that was sort of a quick list that I had jotted down in terms of, and for all the reasons that have already been mentioned. So these are children and families that likely rely more on school offered opportunities for free play and physical activity. Schools are closed, just like a lot of those children are the same that rely on schools for their meals, for example, and for so many other services and supports beyond just academic or educational outcomes. Physical activity and free play is one of those things that we need to think about as an essential that school offers. So when school is closed, recess, PE, before and after school opportunities for physical activity have all been relegated to, you know, the families needing to find their own resources. And then that, of course, is so systemic in terms of who has those opportunities and who has access to that in their neighborhood in terms of park access and families who have kind of the time, the financial resources, and are themselves often the ones that are frontline workers, essential workers. So I think all of these things have just sort of collided in ways that has magnified the inequities that we know already existed in our communities.
Thank you so much. And Jesus, what are you noticing about the inequities that exist in getting free and unstructured play in King County?
Sure. And I would echo a lot of things that have already been said in terms of the same groups who tend to be impacted disparately are the ones that continue to be impacted. I think, you know, in Seattle, at least, we've been pretty fortunate in terms of the investments that we've made in our parks and recreation system, the community centers, the parks. As Caitlin was saying, there's a Trust for Public Land metric that you know says that you should strive to have a park within a 10-minute walk from everyone. And in Seattle, we do pretty well. We're over 90%, but still there's gaps. And those gaps tend to be in the communities that you can imagine. These are our BIPOC communities. And so, you know, maybe I'll add even more of sort of what's happening. And I saw a question in the chat by one of the participants. You know, this pandemic has made it even harder for us particularly the Department of Parks and Recreation to provide access. So our goal is to provide access to everyone and to make decisions with this equity lens, but it's hard enough with the kinds of resources we normally have. And now that we've been impacted significantly by this pandemic and the economic implosion, you know, we have fewer resources and we have to make much tougher decisions with communities about where we allocate those resources for programs and for facilities. You know, we've got significant budget cuts. We've had staffing challenges. And all of that, as you can imagine, tends to impact our communities of color, our lower income communities, the communities that need it the most are impacted the most. And so one of the things we're trying to do in Seattle, at least within Parks and Recreation, is to try to be, to some extent, unapologetic about these decisions that we're making. And that's really hard. Like I'll go to community meetings, we'll talk about our mission of healthy people, healthy environment, strong communities. But we, you know, when we start talking about the resources that we have to allocate, we've got to make these tough decisions. And a couple of examples we've done that here in our budget that's actually being considered by council right now is we've had to reduce a lot of our capital projects. And we made some very deliberate choices to keep the capital projects that are serving under-resourced communities in our budget while having to delay or even cancel other capital projects. And there's a whole a group of stakeholders and advocates on every one of our capital projects, and those folks are going to be really disappointed. But you know, we're doing what we can to try to undo some of this inequity. And then I guess the last thing I'll just kind of double down on within our work is this idea that and I think Caitlin mentioned to it, much of our system is designed as pay to play, right? We if you want to have access to our fields, you got to get a permit. You have to be organized to get permits and all of that. So, you know, there's a report that was put out just today, actually, by the National Recreation and Parks Association surveying parks and recreation agencies, and over 90% of parks and recreation agencies charge registration fees and permit fees. And you know, the good news is 2/3 of us provide some reduction in fees and scholarships, but it's still not enough. And so we have to really think about strategies that we can use to provide access to these amenities to everyone. And that's also a resource conversation, right? How do we do that with fewer resources? I'll end with one quick example we're doing here is, you know, we've done some pilots in our fields in the spring, and we'll do them again this year, where we have, you know, limited number of fields, but they're always constrained by permits by these organized groups. And so what we're trying to do is just create community time where we take these fields out of the permitting system for some amount of time every week, just so that folks can come in and just have unstructured play, or other organizations that aren't quite as organized, I'll say, that can just come and have activities. And we're going to continue to do that more and more, just to make sure that we're providing access to these fields. We have one field in Seattle, in the South Park community, that's being renovated in partnership with a private school. But we've made the decision that for 5 years, we're keeping that field out of our permit system, so that we can allow local groups to create infrastructure there to be able to take advantage of that field. And we think that's going to go a long way to try to undo some of these inequities. But again, I mean, we've got lots and lots of work to do. But I think there are some ways in which we can do that, but it's going to require having really tough conversations with our communities.
Thank you so much, Jesus. And I, for the sake of time, I think I'm going to combine question 3 and 4. Adrian, can you? Yes. So what have you or your organization done in response to the inequities that exist in free play? And explain briefly your efforts or response to addressing the inequities just discussed. So I'm going to ask, I'll start with Jesus.
Thank you. Sure. I think that since the start of the pandemic, I'll sort of talk just generally, specifically around what we're dealing with now. But you know, our big focus was really keeping parks open and making sure. Again, we've got over 480 parks in our system. Many of them are within 10-minute walks of our residents. But and particularly for the folks who don't have backyards, don't have access to open space in their neighborhood, we wanted to keep all of our parks open, and especially large regional parks, which tend to be where folks go. And so we did a lot of work to do that, to gather data, to do messaging and encourage folks to comply with the public health regulations, because we didn't want, as we were trying to bring people outdoors, we didn't want to be the cause of any increases in the infection rate. So that was our big focus. But also, we've been looking for ways to encourage socially distant activities for our young folks outdoors. We had our street team would go out and connect with the teens that they normally connect with, just to make sure we kept them connected in positive ways. Particularly, these are youngsters whose families, unfortunately, are working 2 or 3 jobs and are not able to be at home and provide guidance. And we wanted to make sure that during the summer we could keep them connected to positive things. During the school year, we also really focused, especially this year, in creating support for the virtual learning, and have created these what we're calling teen hubs in certain community centers around the city, and particularly in the neediest communities, so that kiddos who weren't able to get support at home, or didn't have Wi-Fi, or couldn't connect, or needed technology support, or just mental health support, could come to some of our community centers and get that support. We're also working to really look at because we can't be indoors and won't be able to be indoors in a real way for quite some time, bringing recreation outdoors, recreation out into the community. We have mobile recreation programs going out into parks. We have, partnering with the Department of Transportation with their Open Streets program. We did Keep It Moving Streets, and we're continuing to encourage folks to, in a safe way, come outdoors, but to expand sort of the space we all have to be able to be outdoors safely. And so, these are things we're going to continue to do as the department continues to go through this. But our focus really is going to be how we really double down on this equity conversation, making sure that every single investment that we make is done so through that lens.
Thank you so much. And how about Dr. Pooja?
Yeah, I mean, I can speak since the institution in terms of the Hospital and Research Institute is so big, I'll probably speak more to the projects that some of my colleagues and I are working on to kind of both gather more information around what is happening with regard to inequities in free play and trying to do something about it. Some of the projects that I've been working on, particularly with my colleague, Dr. Emily Crocius, is, I think I saw a question about, who is getting free, safe, unstructured play. I mean, I don't think we have great data on it. I think, a lot of us can sort of hypothesize who that is, or, well, maybe some organizations might in terms of who's still accessing it. I know in terms of structured play, a lot of the sports leagues have been in operation for months now in terms of soccer teams and things like that. So going back to that sort of pay to play model for children who are enrolled in those programs, swim teams, other sports, they have been practicing during this time. So I guess some of what we're trying to do is to gather evidence. So we have a national survey that's out now, and we should be getting some information back in the coming weeks and be able to share that in different forums that we can with regard to the physical activity and screen time practices of children throughout the country, and being able to sort of see who is at most risk for not getting almost nobody's probably getting the optimal amounts, but where are those inequities? So we'll have some of that information. We're also, through some currently funded grant projects, working with schools, particularly a school in the Highline School District with UPower, to work on a project to support physical activity and the PE teachers through some play kits that those of you that are in the coalition may have heard about in recent months. And we're also working on a program with Project Nature, which is another local organization, pediatrician supported, on how pediatricians and healthcare providers can get some additional information and resources to talk to families that are coming in for their checkups and things, about encouraging the importance of safe, socially distant physical activity and outdoor time, and using those clinic visits as a way to promote healthy behaviors.
Thank you so much. Caitlin, what are your thoughts on how has your organization done in response to the inequities that exist in free play? And what?
Sure. Yeah, I'll take over. I'm actually going to answer this question in two ways, if that's okay. One, I'd love to talk a little bit about what my organization is doing, but I also want to share ways in which people listening can also take action in their communities, because we're really pushing, individual action. But Parkour Visions, we've been around for 13 years. We provide outdoor recreation programs and education across the county in partnership with parent groups, schools, other community organizations, as well as now online, obviously in response to COVID. And we take a twofold approach. So we try to change the world to be more playful, both by changing the built environment as well as giving people new behaviors. And so the built world by advocating, designing playgrounds and play spaces. We even have a pop-up playground we could take around the city and pop up for a day. And then also giving people the parkour toolbox, giving them new behaviors, which is basically a set of skills, physical movements, as well as a mindset they can take into the environments they have. So you don't need a playground. The benches, curbs, railings, ramps, things you can find right outside your house can be your playground. And so by giving people those, again, movements and mindsets, they can find play anywhere and engage in this kind of activity. And to deal with inequity, you know, we're offering free classes every day of the week, sliding scale online, low cost programs with schools and community organizations. So there's a way for everyone to sort of even rediscover their play abilities. But to take just a few more seconds here, on an individual scale, there are so many things you can do if you have a little bit of time to create more play in your own neighborhood, in the places you live. On the smallest scale, it's grabbing a bucket of chalk and chalking up your sidewalk, encouraging not just, you know, your neighbors, but anyone walking through your neighborhood to play as they walk through. And I'm going to share a Pinterest board afterwards with lots of photos of different ways communities around the country have been doing this. Sort of like kind of a form of tactical urbanism, essentially. And while Jesus spoke a little bit what parks can do, there's a lot of things you can do through the Department of Transportation to bring play to your streets. So you can have like a block party or a petition for a play street, which is you can get your street closed up to 12 hours a week for up to 6 months. So that's something that you and your neighbors can petition and get the city to do for you. There's also the Stay Healthy Block initiative, which I'm sure a lot of people are familiar with. On a more long-term scale, things like parklets, where you can have the city take a couple parking spaces out of your street and turn it into a park. Even things like street murals and signal box art are things you can, as an individual, go off, request a permit from the city as a part of their adaptive street program. So there are actually quite a number of avenues to even physically change your localized environment to have opportunities to play and recreate in your immediate neighborhood on the street you live. So all of those can be found on the DOT website, and we can link to them afterwards. But don't be afraid to try to take action and change your neighborhood as well.
Thank you so much. Philippa, what are your thoughts?
So many thoughts. I was just writing, my whole page is full. So one of the things I was thinking about is what we traditionally do, and that is talking to families and not assuming that just because it's there, people will go. And so we've spent a lot of times doing wellness calls and mass text to our families just to kind of check in, and specifically right now during the pandemic, to just kind of see how things are going and what's happening in their lives. And what we've gained from that is, like we've mentioned and we've all talked about, people want to be out. And one of the things that Caitlin mentioned earlier was things are pay to play. Well, for us, we want to make sure to reduce or limit that barrier. So anything that we have done has been completely free. We've participated in conversations like this because I'm not an expert, we aren't the experts. So connecting with other agencies and organizations that know this work and bringing it back to our community. We've also did a lot of pop-up distribution events. So we know we can't gather like we used to do, but what we can do is partner with agencies like UPower, like the Rave Foundation, various different other agencies that, provide play equipment. Our families traditionally like basketball, like jump rope, like soccer. And so these agencies have equipment. So we have been able to receive some of those things and then do distribution events so that families could utilize things when they could take it to the park and play with their families, because they can't play in larger groups right now. I also really appreciated Caitlin bringing up that it's not just necessarily just the physical play, but also art. We have partnered with organizations. We've partnered with Seattle Public Schools. We've partnered to assemble art kits and distribute it to families throughout door to door so that they could, explore that. I also really, I really like the chalk idea. We have so many sidewalks. We have a huge parking lot right here. I'd love to, see if families are interested in that. So to sum it up, we just listen to our families and then go and connect the work. And also, last thing I'll say is all of those resources that you've kind of mentioned, like the parklets, the street play, close off the streets, we've also done those things too, because we want to make sure that maybe our families may not have the knowledge to, or the time, or whatever the case may be, to fill out an application for a street closure. We have staff and the capacity to do that. So we've done those things as well.
Thank you so much, Philippa, and all the other panelists. And I understand that we try to be intentional about making sure that we honor your time. And unfortunately, we don't have time for questions and answers, but if you have any direct questions, please either write it in the chat box, or Adrian will put in the chat box an email address where you can send us questions, and hopefully the right panelists will respond to your question. I'm gonna invite Adrian to do any closing comments.
Great. Thanks, Bilan. Hi, everybody. Let me turn on my video here. Hi, my name is Adrian Moore. I support the King County Play Equity Coalition. I just want to thank everybody for joining us. Thank the panelists for this conversation. Obviously, with 45 minutes, I feel like we're just digging into it. So thanks, Bilan, for definitely getting us through a lot of content in a short period of time. I wanted to quickly share that we will, if you registered, we will share this deck with you. You should see in front of you, there's a contact information for all of our panelists and for Bilan. So you'll get that when you get the deck. We'll also send a brief resource page with some of the resources that were discussed today and a little bit more. In the final few minutes here, I just wanted to make sure, oh, hang on one second. I wanted to just highlight a little bit more broadly the Play Equity Coalition here in King County that Bilan is a member of the leadership group of, and just go into a little bit of detail about what we do and why we do it. So we are now over 90 members strong, and that includes a really cross-sectional group of individuals, community-based organizations, school-based organizations, government agencies, and sort of the wide swath of folks who are interested in play equity, in youth sports, in outdoor recreation, in free play, and it's a really wide tent around physical activity, equity, and health. So if wanted to just highlight how our work is happening right now. We currently have action teams that are meeting. These are member-driven action teams around, mostly around COVID issues. So we've got one that's program focused that talks about return to play, and is really sort of a developing learning community around organizations, for organizations who are thinking about what it looks like to return to play, and now that maybe we're going to be pulling back a little bit, a support for sort of what that looks like. We have an advocacy group that talks more on a systems and policy level about how we, for example, work with schools to make sure physical activity is still part of the school day, for example. And then we're shortly rolling out a land use group that is going to think about and look at joint use agreements, for example, and sort of bring together a cross section of folks working in some of the things we talked about today. Who has space, where's the space, who's using it, and who's not, and how we sort of we build those bridges via policy and land use decisions. The last thing that is currently live is that we're also seeding some collaborations. So if you join as a member, you're eligible to a small amount of funding that will help seed partnerships and collaborations that's active right now. And then this is the first in a series of 3 webinars that we're going to do. So we We don't quite have a date for the next one, but we know it'll be probably early February next year. So stay tuned for that. If you're registered for this one, we'll make sure that you get an announcement about that. It'll also be on our Twitter account and on our newsletter, and we'll blast it out once we know. So the final thing is just if you're interested about this and you're wondering how to get more involved, you can always go to our website. All of the work is there. All the list of members is there. You can join. So if you're interested in, sort of getting even more involved and getting our weekly member updates, and if membership's not a great fit for you, we're always looking for support, always looking for other ways that folks can plug in and help the cause. So there's an email there too, so you can feel free to email us. And look at that, I got us right under the time, 12:45. Oh, and I see in the chat, yep, Julie reminded me that the topic of the next webinar will be physical activity and mental health specifically. So the relationship between those and how those two things connect to one another. So I, again, just want to thank the panelists so much. Want to thank Bilan for guiding us. And I want to thank all of you for joining for a great lunch Zoom session. Stay healthy. We will follow up via email, and take care of yourselves. Thank you.
Thank you so much, Adrienne, and thank you to all of our panelists and everybody who's participated today. And we look forward to seeing you in February. God bless.
Thank you.
Thank you, everyone.
Ew.
Thank you.
Feel free to reach out if you are interested in anything we talked about.
Thanks, everyone.
Thank you. Adrienne, I'm gonna need you to.
I can end it. Great.
My
Oh, that's right. Yes. All right. Okay. We're signing off. Thanks, everybody.